We know from learning theoretical studies that our expectations are not only formed by our own personal first-hand experiences, but also by social information, for example, observation. And these observations can lead to positive or negative experiences and form positive or negative expectations. For example, in a positive way, when we observe somebody else getting better after receiving a certain treatment, but also negative if we observe somebody having symptoms such as shortness of breath or pain as a side effect of a certain treatment. And we are interested in how these observations actually shape our expectation and then form our own first-hand experiences. So studies in healthy participants have shown that observed experiences, such as observed pain or fear, are similarly processed as first-hand experiences of pain. And of course, there is a difference, since when we observe painful stimuli, we don't experience the first-hand nociception of that pain. But in essence, there are a lot of brain regions that overlap between observation and first-hand experiences, and there are even neurotransmitters that are shared between both forms of learning. And we in our research group are particularly interested in observation of shortness of breath and breathing restriction. And these are interoceptive stimuli. That means that they come from inside our body, our bodily symptoms. So the question is, can we learn from observation from this interoceptive stimuli? So can we observe stimuli that are only experienced inside the body of others? We know that observations are always variable. So the intensity of observed symptoms vary despite the same underlying illness, for example. And we are particularly interested in how these often varying, uncertain observation then actually shape our expectation. In an initial study, we actually found that observing a varying degree of pain symptoms in another individual led to less reliance on your own first-hand experiences. So we are constantly connected to other people and observe their experiences. And we should be aware that observing others' experiences, positive or negative, shape our expectation and thereby influence our first-hand experiences. For example, if we observe somebody else's outcomes of a treatment, it shapes how we expect that our treatment might go. And even if we observe unreliant experiences of others, that shapes how we rely ourselves on our own first-hand experiences. So we should be careful what we attune to, positive or negative observation.